Oh, okay. My name's Natalie. I'm a chiropractor. I've been out for like 3 years, and I'm working at UTM location. Anything else you guys want to know?
Caroline?
Yeah, I'm Caroline. I work at the sports clinic as a physio.
And I'm Kevin Fairfield. For those who don't know me, I'm I'm a partner of both the sports clinic and UTM, or the sports clinic at UTM and Winston Park. I'm a physio and osteopath, so I got a bit of a unique understanding of both professions, a lot of the strengths and weaknesses of both. So that's to piggyback on what Jeremy says. I've had those questions for 23 years, actually, the differences, because there's a lot of similarities, and we'd like to basically answer some of those questions today.
Hey guys, so the chat box, you guys can go to the bottom and hit the chat box. I'll be hanging out there. And I want you guys to write right now which of the three professions you're most familiar with at this point in time. And then maybe I'm going to get Caroline to start with maybe the schooling, the background, some of just the basics behind it.
Yeah, so for physiotherapy, all of us have done an undergraduate degree in various degrees. So most of us had done a kinesiology bachelor's to begin with. And then after our 4 years of bachelor's, then we decided we want to go into physio school. And that's a master's program. So for most of us at UTM, we have graduated from U of T, and that's where I've graduated from as well. And that's another 2 years master's program. And what's really neat about UTM is that a lot of our physios have actually done a ton of continuing education afterwards. So we spend probably around $3,000 to $5,000, maybe even more per year on our continuing education. And UTM is very hands-on, as some of you guys know, if you've been to our clinic before. We're very big on manual therapy, and so we learn how to do different spinal adjustments, different adjustments on different parts of the body. And so we're different at UTM because we care a lot about not just doing, finishing our degrees, but also continuing more courses so that we can help you guys better.
Lovely. Nat?
Yeah, so kind of similar to physio in that you do an undergraduate degree. Usually what you end up doing is usually kinesiology or something life sciences because you're interested in the human body at that point. So after your four-year degree, then you end up going into your doctorate of chiropractic. There's actually only 2 schools in Canada. There's the one in North York and our sister college, which is in Quebec, but it's quite small. So most people go to the one in Ontario. So that's 4 years. And in those 4 years, that's where you learn your spinal manipulations, as well as like you learn your general sciences of like microbiology, physiology, and all that, the works. And yeah, so in that includes a 12-month internship, and that helps set you up for in-clinic practice where you get to kind of get exposed to different populations, which is pretty helpful for when I came out into practice. Gave me a little bit more, got my experience up before I was actually out with the public. But yeah, so that's kind of the main schooling part of it. Same thing, we do a lot of continuing education and just keeping up with it.
Great, thanks. I had a bit of a different journey for those who know me. Unlike these dynamos, I actually I thought I was going to law school personally. So I basically jumped into university and did an undergraduate degree in a little bit of everything, to be honest with you. I had no idea what I wanted to do. So my running joke is I thought science started with PH, okay, in terms of, I'd really never interested in sciences. Interested, but never really wanted to pursue it. So the only school that looked at me was Mac. So I basically had high enough marks to be able to apply to the health science program at Mac, and I actually remarkably got in. And once I got in, it was easy for me. I just always found that studying anatomy and physiology and neurology was just, I had a bit of not a gift, I had to work at it, but things sunk into my head. And I think McMaster University, which is really the university that started evidence-based practice. So when you look at everybody in today's COVID environment, you're talking about all the research and all that paradigm started at Mac in the world. So it's a pretty interesting, and I'm actually treat some of the original founders of evidence-based medicine currently. It was a pretty easy transition for me. And then afterwards, it was just like 25 years of, finishing physio school, becoming a manipulative physio. And then I jumped into osteopathy because I just felt like my, as much as Caroline and I were Part B or manipulative physios, or Caroline's in her last little segue to become that top 1% of physiotherapists in Canada, in the world. So I felt like that wasn't enough for me. So I pursued osteopathy, pursued a lot of dissection, now into functional medicine. And one thing that I think attracts all of us here is this lifelong learning idea, is that I'm almost 50 years old and I feel like I'm just scratching the surface. So there's a lot of carryover. If you see really good physios and really good chiropractors, they spend a lot of quality time with you. It's one-on-one. And I always say, it really is a lot of, everybody has a different flair in terms of how they do things, but the overall similarities of their thought process is digging deeper into the causation of what your problem is. That's the key. Some people focus on symptoms. We focus on the cause or causes of why you're in there, and it extends over your life. So that would be my little segue into some of the similarities and differences.
Yeah, I agree. I always kind of refer to it as a little extra spice, that everyone has their own different variety, but same thing.
Yeah, one of the things I'd say about the physio world, at least my experience, is we spend a lot of time looking at research, at least at MAC, reading a lot of research. But really, the foundation of everything, it's kind of like a big hose, and they're just trying to, you absorb so much information, there's really no practical application. And I think that's like that in all disciplines until you go and work and gain that experience and the mileage, and then continue on with your education while you're working. But I found it was a bit of a disconnect in the physio world in terms of, you learn neurology, and that's this area. You learn orthopedics and sports injuries, and that's over here. Then you learn about the heart and the respiratory system, and that's over there. It's very convoluted. I found with my experience and bringing in osteopathy, you bring everything into one, because you are one body. All those things matter. Your immune system, people come into with knee problems. It matters what's going on in your pelvis, what's your surgical history, how you're living your life, are you active, what are you eating, is there an underlying inflammatory process? It really starts to get pretty deep. If you think that way, you'll start to approach that, and I think that's what a lot of us do at the sports clinic.
Yeah, Kev, I mean, I think just to scale it back a little bit in terms of someone who comes in, let's just say with, I don't know, maybe one of our favorite, like plantar fasciitis, they come in, and I think Natalie would also agree, we have our normal assessment, which is we go through the subjective, right? We ask about the patient's symptoms, and we go through that, and then we do our objective, which is we get them to walk and we get them to squat, and then we start to put our hands on them and look through range of motion and things like that. I guess maybe if you could even fill in what you would go beyond that, in terms of how osteopathy can maybe look at some things that maybe a physio and a chiro don't exactly look at, because we would, for example, with plantar fasciitis, we obviously look at the feet, and we look at the knees and the hips, and we even go to the lumbar spine. But maybe I'm wondering if you could delve into, because I know you do some really neat stuff with, the organs and the viscera and stuff like that. And maybe you could walk everyone through that take on it.
Yeah, it's, I was very privileged to learn from a lot of osteopaths who are MDs. So they really have they bridged, again, the gap between allopathic medicine. You need to go see your physician. Everybody needs a primary healthcare professional, and allied type of healthcare professionals, which what we are. When people come in with a symptom, do you take it at face value? Like, is it plantar fasciitis? We'll use that example. Mm-hmm. A lot of healthcare professionals, not us, but a lot of people would be like, oh, it's a problem in your foot, and they've already made the diagnosis without even thinking twice. So we know to basically look at the container of the body, look at how the body moves from a locomotion perspective, the foot, the knee, the hip, the pelvis, and you can work your way all the way up to the neck, because you are one body. The osteopathic look also looks at what's happening to the contents of the body. How is the visceral system involved? Especially if you take, you know, I always say I have a lot more female clients than I do male clients. And if you get that classic, person who comes in and they're in their mid 40s and they have plantar fasciitis, but they've also had 3 children and they've had 2 C-section scars. To me, that's not a red flag, but it's an alarming thing. I got to look at that because their body's gone through a big transformation, kind of in their center of gravity. They've actually been surgically, a lot of the tissue has been cut open, obviously because of the delivery was not natural. That plays a role in the fascial system of the body. So that's where a good history points you in the direction of, do I need to look at this or do I not need to look at that? But if you're not asking the questions and you're not looking at really the holistic nature of the person, you'll miss that. But is that an osteopathic thing? I don't think so. I think it's just a matter of, like in our office, we do that. I know a lot of osteopaths who basically don't even think that way. So it's kind of bridging the gap. I think the advantage we have is we have a really good background. You get undergrad, you go to university. It really is a good background of the fundamentals of medicine as a chiropractor and a physiotherapist. Some of these osteopaths don't have that background. So they're just coming in out of the blue without having a good foundation of medicine. And sometimes they're not even the same wavelength, and they're just touching your head for your foot for an hour. So that's not good therapy either. You got to know when to use, you've got to scan through a body and determine what are the things that are wrong in this body, and let's fix it for that foot problem. I'd say that's how you bridge the gap between what we all do.
Can you guys outline, because I find when I explain this to people, I find it's easy to outline some of the differences by pointing out the weak spots in each profession, and we all have them and they're all different. If you guys can elaborate on the weak spots of each profession, because I know once they get the individual as a good practitioner, it gets really hard to tell who's who. Like if you're watching myself treat or any of you guys, I might be working on the diaphragm one day and then the foot, or 1 minute I'm on the foot, then I'm on the diaphragm, then I'm on the hip flexor. It's all over the place. But if you can outline what it looks like from a novice standpoint, because that's 80% of practitioners, that just is the way it is. So outline that, that'd be great.
Nat, do you want to take that one up?
Yeah, I guess I should. Yeah, so fortunately at UTM, that isn't the case, and that's not how I practice. But a lot of chiropractors, I guess, I always like to say old school chiropractic views is more purely adjusting and maybe even doing it on a weekly basis for like a year-long treatment plan, which just really, that isn't a treatment plan, because that's just, you're not really solving any issues if you need to go every week for an entire year. And even sometimes more. I find it's more, thankfully, well, not thankfully, but it tends to be more in smaller towns where you get more of that sign up for this, buy your adjustments in bulk for 5,000, 6,000, whatever the amount is. That's definitely not, I like to say the more modern chiropractor is more of like kind of more similar to like that osteo physio approach, where we do more like muscle work, joints, and the mix of exercise as well. And then actually have a real treatment plan so people can see their success and then actually be discharged at an appropriate time. Of course, everyone needs like some sort of like maintenance cares. We're always doing stuff, but once a week, every week for the rest of your life is kind of a lot. And I know, because I was adjusted a lot during school, and it's just not necessary. It's not that I wasn't significantly better getting adjusted every day. It just was something I had to do for training. So that's my main difference for chiro, which I find, but I'm sure there's others too.
Caroline, you want to chime in on physio?
Yeah, I know, again, for physio, a lot of people have had a bad experience with just getting modalities done. So if you're going to a physio clinic that is just sticking the TENS machine or an IFC machine on you for half an hour and charging you $60 and having you walk out the door, I know that that's something that is definitely a weak spot on a lot of physios. We're very much known for giving an exercise program, but I find that one of the weak things that physios struggle with is actually explaining the intention of a specific exercise or an exercise program. So, you know, something as simple as some shoulder strengthening exercises. people are just given, band work. And I get that